At times talking about this health insecurity and lives that are lost and families that are crying. When you're in Lagos, when you're in
Hmm,
Abuja, or even anywhere in any part of the Nigeria,
hmm,
especially families who've lost members of the family. And you're
hmm,
talking about insecurity so loosely, the way we do in Southwest at times.
hmm,
I mean, there are things you don't say when it comes to insecurity. That's why, if you notice, I never touched on the fire share issue
hmm,
until some people raised it, because it does not make sense to be pointing accusing fingers right now. It sounds political, especially for
hmm,
someone in the opposition. And you're not
hmm,
coming out with facts to say, I have this proof, this man is responsible, let's hold him to it. So it provides the, we need to be careful. This country belongs to each and every one of us. And it is
exactly.
so sad the way we talk about insecurity, the way we discuss insecurity. Globally, there are certain things you don't say when it comes
Hmm,
to insecurity reporting. But for us,
hmm,
we trivialize it. We don't care
hmm,
about the mental state of the people. We endanger the people in captivity. We say many things. Yesterday, for example, there was a talk. If not for my mom, I saw it in the papers. I'm often careful in the news. I'm often careful when I read something online. And I saw that somewhere, was it in Badagry, there were reports that headers or kidnappers are taking over. But we have a
hmm,
family friend who has a school there. She said when she heard it too, she quickly called all the parents, come and take your children. They shut down the school. But later on, the community, Badagry and some axes are still largely villages. So they asked
hmm,
that I think the vigilantes also of the area gathered, and they did a sweep of the area to find out where these people are. And they realized that
hmm.
it was the what you call the land grabbers, the Omoniles that were fighting and shooting and all that. You know, anyway, let's do health.
Hmm.
Prof is here with us. Good morning, Prof.
Good morning, Kyle.
Yes, sir. How are you doing today?
I'm doing good. I'm doing
Mm,
good.
mm. Good to have you join us. It's good to
Thank you.
have you here, and at least know that there are still societies where people, with due respect, where people discuss things that are very progressive. And I'm not talking
Yes.
about APC. I mean
Mm-mm.
progressive in the real sense of the word. You know,
Yes.
uh, Prof, it is well. I think I
Hmm.
might need to come to the UK to see what do you call them again? The people that have joined us in the last two episodes for my mental
The,
check.
the Africanness group.
Africanness group, exactly. I might need to, because the way we trivialize issues around insecurity, it just knocks me off.
Hmm.
Knocks
No,
me off. Yeah.
the country is it's in a very terrible state, and I think I should, because obviously you mentioned mental health.
Mm,
It makes me really very concerned and worried about, the mental health of the Nigerian populace. I feel like at a population level, there's a mental health crisis
yeah.
because the population has been so overwhelmed by things that they shouldn't ordinarily be exposed to,
Mm.
from financial insecurity to physical insecurity to political
Emotional
insecurity,
relationship insecurity, religious
everything,
insecurity.
religious insecurity. So, like the average lifestyle of the Nigerian, the lifestyle of the average Nigerian is jeopardy,
Mm,
is framed by jeopardy.
yeah.
You go out and you come back every day, you give testimony that, today was not the day. Uh-huh.
you know, it's and even when you're driving is a hazard in Lagos itself. In some parts
It
of Nigeria,
is.
Lagos as an example, you're on
It
a
is.
bike, the Korokways are the tricycles are harassing you. You're in a tricycle, the Korokwe, the small buses are harassing you. You're in a
Mm,
bus, four-wheel drives are harassing you. You're in a four-wheel drive, tippers are harassing you. You're in a tipper,
yeah.
container laden trucks are harassing you. Everybody that has an edge is just harassing the person at the bottom.
And that's the national culture these days, where
Yes,
it's not a culture of intimidation. Power
exactly.
is
Power
is
play.
is the holy grail. You look for power to intimidate other people. And we've lost the decency that makes up a society. So this is really something that should have everybody worried,
It should.
because it goes it goes beyond political party. It goes beyond your tribe.
Yes.
It's actually about who you are as a human being and whether or not you're able to live a fulfilling and decent life in the
Mm.
country. So,
Mm.
yeah.
It is. But anyway, there are other issues that while we're carried away with all the political maneuvering and the defections, and when we're talking about all what is happening in Nigeria, there is a health issue that everybody should be focusing on. And that's why today we're looking at that. And let me just say this, that pursuant to paragraph 2 of the Article 12, that is determination of a public health emergency of international concern. Remember, determination of a public health emergency of international concern, including a pandemic emergency of the International Health Regulations 2005, the Director General of the World Health Organization, that's WHO, after having consulted the states parties where the event is known to be currently occurring. You know the event I'm talking about shortly. When I mentioned countries like Congo and Uganda, the Director General has determined that Ebola disease caused by Budibugyo virus is in the Democratic Republic of Congo, and Uganda constitutes a public health emergency of international concern. Now, the question is, well, is it a question? Just, it means that it does not really meet the criteria of pandemic emergency. So if it doesn't meet the criteria of pandemic emergency, all this talk around Ebola, is there anything to be scared of? Or should
Oh,
we
yes.
just say it's not yet an pandemic state? Prof.
Oh, certainly, Kayode. So you see the last bit in that statement you made that it does not meet the criteria of a pandemic emergency. It is mostly because in the 2024 amendment of the International Health Regulation,
Mm.
a level of threats, a higher level of threats called a pandemic emergency was introduced by the amendment made under that regulation.
Mm.
The pandemic emergency was introduced as a new category to describe a very, very, very high level of, a threat to activate very strong global responses. But this does not mean that the public health emergency of international concern is not serious, because under the previous regime before the 2024 amendments,
Mm.
a declaration of a public health emergency of international concern was equal to a pandemic. In other words, when the WHO says this is the public health emergency of international concern, this was another language for saying it was a pandemic.
Mm.
So the 2024 amendment said, okay, like we are creating a new class above public health emergency of international concern called pandemic emergency. So in other words, it is still a very serious event that we are witnessing. But then there are reasons why everybody should be really very concerned about the Bundibugyo virus, the BVD, as we call it for short these days. The Bundibugyo virus is a strain of the Ebola outbreak. Now, here is what we need to note about this. The previous Ebola strain that happened in 2014 and in subsequent years was called the Zaire strain. Okay, so it was the Zaire strain that happened in 2014 and 2018 and so on and so forth. Now, there has been much research that has been done about the Zaire strain, and vaccines have been produced to combat the Zaire strain. Now, the Bundibugyo virus disease that we are now witnessing is something that is entirely new. Okay? It's something that is entirely new. Unlike the Zaire strain, there are currently no approved Bundibugyo virus specific therapeutics or vaccines. As such, even by the WHO, this event is considered to be extraordinary. Okay? So in other words, what I'm telling you is that here is a virus that is picking up based on the WHO analysis about the virus. It says they say that the event constitutes a public health risk to other state parties, okay, through the international spread of disease, okay. What has been documented already is that there has already been an international spread with 2 confirmed cases in Kampala, Uganda, on 15th and 16th May, following travel from the Democratic Republic of Congo. Both confirmed cases were admitted to intensive care units in Kampala, and neighboring countries sharing land borders with the Democratic Republic of Congo are considered at high risk for further spread due to population mobility, trade, and travel linkages, and ongoing epidemiological uncertainty about the disease. In other words, what I'm telling you is that the difference between Nigeria and the BVD is somebody from Congo coming to Nigeria with the virus. You understand? Now, what happens if that happens? Well, it's going to be really tough for us because all we can do is to trace, contact trace, and quarantine, but then there's no sort of drug or vaccine to be administered because none has been developed at this point. Research is only just being undertaken to begin to kind of like prepare a response to the virus. So in other words, this is something that I'm sure that our National Center for Disease Control have their eyes on. They're looking at it with keen interest. But then it's also something that the population needs to begin to sort of like turn its attention. You know how like you're reading something in the news and it's kind of like, oh no, this is only happening in far away East Africa. It doesn't concern us. Well, it should concern us really, because in the West, they are already reacting. They are already beginning to line up countries for travel bans and travel restrictions. All right. Now, if you travel to Africa and you're coming back to a place like Canada or the United States, they're already, especially if you're coming from like Uganda, you're going straight into like 30-day quarantine, right? You're going straight into quarantine. No one's going to listen to any story from you. And then, in fact, that is if they even allow nationals from these countries to come, okay? Already, Canada has placed travel restrictions on many countries around the region of this outbreak, completely, ban travel, despite the WHO IHR amendment saying that travel restrictions should not be arbitrarily resorted to unless there is clear scientific evidence. But then Canada is not waiting for scientific evidence. They are acting to protect their population. Now, I'm not saying obviously that Nigeria should be shutting down its borders or all of that. But what I'm saying is that, one, there needs to be heightened public awareness about the fact that BVD is a thing. And it is, that was how Ebola 2014 started. It started in faraway Guinea and Sierra Leone, and we were looking at it until Patrick Sawyer came to Nigeria. And suddenly, everybody in Nigeria was now kind of like panicking. We now started having all kinds of response. Use salt, use Omo, use detergent. You understand? So we are consumed now. We are kind of like moments. Everybody's preparing for 2027. But then let's not forget that while we are preparing for 2027, the world is not waiting for us. Like, things are happening. Health continues to be very important. And we should be paying attention to public health crises such as this, because the BVD has the potential, if it is not properly managed, to get out of control. Okay. And so, yeah, I'll say I'll stop there for now, as we carry on with the conversation.
Because when you were speaking, I was wondering, okay, I thought of it last week that should we be closing our borders right now? And which borders should we be closing? If you're saying you're not advising Nigeria to close borders now, what should Nigeria as a nation and a government be doing currently?
Well, look, the WHO has come up with some helpful directives about, what different countries in different categories should be doing. Their direction to parties who are located where the event is occurring is quite very detailed. There are directions to countries whose land borders are joining the countries with documented Bundibugyo virus disease. is also very clear. Then they have directives for all other countries like Nigeria that do not share any sort of like land borders. So with these affected areas. So it says that no country should close its borders or place any restriction on travel and trade. That's what the WHO is advising.
I see.
Such measures are usually implemented out of fear and have no basis in science.
Mm.
The push the movement of people and goods to informal border crossings that are not monitored and increase the chances of the spread of the disease. So when we start shutting down our borders, what happens is that people start moving through,
Legally.
illegally,
Mm.
it's crossing illegally. And if you don't have opportunity to monitor people who are crossing illegally, what then happens is that the very thing you're trying to prevent will then start happening. What instead should be happening is that national authorities should work with airlines and other transport and tourism industries to ensure that they do not exceed WHO's advice on international traffic. And also, the WHO has advised that state parties should provide travelers to BVD affected and at-risk areas with relevant information on risk, measures to minimize those risks, and advice for managing a potential exposure. Imagine if you're living in, say, you're a resident of Uganda, maybe you're a Nigerian, you're based in Uganda, and you visited Nigeria, and then you want to go back to your base, right?
Mm.
Yeah, if they tell you, oh, there's BVD outbreak, is that going to stop you from going back to your base? That's where you
Home is
that's where you're
home.
based.
Mm-hmm.
Home is home, isn't it?
Yeah.
Like there are Nigerians who are there. There are Nigerians who will be coming from East Africa coming to visit Nigeria. So you're not going to say, oh no, you're from Uganda, but I'm a Nigerian. I'm carrying a Nigerian passport. You cannot
Yeah,
exclude
exactly.
your citizen, isn't it?
Mm.
We have not started, but then Nigeria is a place where the unprecedented can become precedented. So who knows? Who knows? But the
No, but
point is, so far so good. It hasn't happened before.
that's it. That's it. Okay, but when you look at this now, in a country like Nigeria where we have porous borders, in a country like Nigeria where we've seen events, of course, we've been told it's improved in terms of the welcome party you get at the airport. That it's not every time they ask for money now. But in such a country, what should we be doing? Because people walking freely from Benin Republic, they're walking freely from Niger, they're walking freely from Cameroon. There are many unauthorized routes that people take even as at today. What should we do to ensure that whether you take the unauthorized routes or you take the actual border channel, you are protected. You are not able to bring in this virus into Nigeria.
So obviously, it goes without saying that we should not have unprotected borders. Technology has advanced to such a stage where even without physical personnel manning the border, you can actually have your borders properly monitored. Okay, you have drone technologies, you have all kinds of technologies that can be deployed and implemented to protect your land borders from being porous. It is a huge risk, not just a public health risk, but also a security risk to have borders where you don't have any sort of monitoring. And that probably explains why we've been having, a lot of the kidnappers. You look at the pictures you see on the in the newspaper or social media, and you say, these people, I know, like Nigerians, we know ourselves. We know the way our forehead is shaped. You understand? We look at these people don't look like Nigerians. And most of the time, we're accurately, we are correct on that. Like, these are people who have sneaked into the border from other theaters of conflict in North Africa, in Central Africa. They come into Nigeria and terrorize your citizens. And, you've been speaking about this on the previous session. It's because of these porous borders. Now, the public health emergency risk of having porous borders is evident in moments like this. Imagine somebody with BVD, the BVD disease, walking in from Benin Republic into Badagry, or where does Benin Republic open up to?
Into Badagry, yes.
Into Badagry. And then, Lagos is such a population, such a dense place.
Densely populated place, yeah.
You understand? And Lagos is one place that links up to the rest of the country. Like you have flights going to all parts of the country from Lagos.
Mm.
Okay? So the fastest way to penetrate Nigeria is through Lagos. If something is happening in Maiduguri, in Sokoto, it's very easy to isolate those places and kind of like say, you know what, we can block off because, not much, it's not a terminus. Those places are not your usual central meeting point. But Lagos is a central meeting point, is the economic lifeblood of the country. Nothing can happen commerce-wise, or nothing major or significant can happen commerce-wise without Lagos involved. So in other words, this is such a weak point for us as a country. Therefore, any sort of like, unmonitored border space is a huge national security risk. So to your question, what should we be doing? Well, we shouldn't be having such porous borders. We've always been talking about porous borders for decades now. The technology has advanced to the point where you don't need to you don't need to man for man the borders. You can use technology, okay, to police your borders. So we can do better. That's the bottom line.
All right. And when you look at this, this new virus, the BBV, how completely different is it from the previous Ebola? I mean, the transmission period, the gestation, how long does it stay in the body before you begin to see? Has the WHO come up with all these findings yet?
So those findings are the findings that one establishes when you are close to developing a vaccine or a response for it. And so this is why the WHO says that this is such an extraordinary situation, because there is a lot that the WHO and the scientists that work with it do not know about the BVD. What we're saying is that this is a strain that right now the public health experts are trying to understand. They're trying to study. They do know certain protocols that have worked in the past for the Zaire strain. But whether or not those protocols will be as effective for the BVD is left for observation. Is for us to kind of like, so those responses are only now being developed. So right now, there is no therapeutic or there's no vaccine that can be administered.
So we don't know if we can slow it down at all. We don't know if it responds to any medication in any way as of today.
Yes, that knowledge is not there as of today. That is why the WHO has, been, they unlike other Ebola, because since 2014 there have been other outbreaks of Ebola, and you haven't been hearing it in the news. But then this one, everybody is panicking because even in the WHO's accounts, it says that there are currently no approved BVDs, virus-specific therapeutics or vaccine. So it considers this event to be extraordinary. You understand? So it is. Do we have Ebola vaccines that have worked in the other this thing? Yes, but for this particular one, there's a lot that is still being understood about the PVD.
So which means that technically anybody that contacts the virus right now is going to be more like a guinea pig. You need to run a lot of tests to get
absolutely observed. There are lots of observation about how it is saying, quarantining, taking some sort of course, usually utilizing PPE, hoping that it works. Because under the Zaire strain, we have personal protective equipment that those people will wear to deal with the distance. So you will hope that the same PPE that work for the Zaire strain will work for the BVD and all of that. So far, so good. It is only now that they're kind of like, looking at, how to respond to it. They're trying to understand this. It started, sometime in May, but then since then, it's been kind of like, it's been picking up gradually.
Now, what makes this strain different? Because since the Ebola outbreak, we've heard and experienced a series of different similar viruses, Ebola viruses, and
Mm.
You might hear one or two in the country, then it calms down. You hear this there, you hear that there, then it fizzled out. It doesn't spread. But why is this one gaining so much traction? Is it because people moved, or is it because of the kind of virus it is?
So there are a number of things that are at play here. The first is that this site of outbreak, Congo, DRC, and then the Uganda, these are places where there is, active movements of, people and goods, open borders, porous borders between the two countries. And so you have, very, active exchanges taking place in those locations. So that's one thing. Now, the other thing is obviously without any therapeutic or way to kind of like mitigate or slow down or to administer some sort of vaccine, um, it is pretty much left. It's like wildfire that is left to burn by itself and to burn out or something like that. Um, so that's the other thing. Now, the third thing is that since the virus started, the 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 number of cases that have been suspected continues to increase, even though the samples of confirmed cases remains low in the 200s. But then you have unconfirmed cases or suspected cases ranging in the 900, 1,000 range. Okay, so and usually during outbreaks such as this, unconfirmed cases are usually the area where we don't know what we don't know. Do you understand? And so you want to see that the numbers for the unconfirmed cases are low. But here we are dealing with a situation where the unconfirmed cases, the number continues to sort of like grow. So the event is a high risk event. It's considered a high risk because of how population mobility, trade and travel linkages, and the ongoing epidemiological uncertainty is affecting the response to the situation. And therefore, this is why the WHO has been really very sort of clear from the outset. And kudos to the WHO, because in 2014, and this has always been like, if you've listened to me speak and write about the WHO, I've always written with a lot of critique in my tone to say, and this has always been because of the way the WHO handled the Ebola virus in 2014, when thousands of people were dying and the WHO refused to declare it to be a public health emergency of international concern. Then that was under the old regime where a public health emergency of international concern was tantamount to a pandemic. And we didn't have something like a pandemic emergency, which is a higher level of threat like COVID. So for it to be a pandemic emergency, WHO is saying that it has to be like COVID-like. And I suppose it is because of what happened in 2014 that the WHO introduced the current amendments, because there are clear parameters of what would be a pandemic like COVID, all right? And so the WHO felt that in 2014, that level of widespread impact had not been reached. And so there was no in-between line for it to act. So it just kept quiet and continued to observe, even though people were dying. But in the current case, because of the amendment, as soon as the first case was announced, the WHO quickly summoned the affected countries and said, is this something that we should be concerned about? They say, yes, it's something we should be concerned about. And the WHO immediately declared it to be a public health emergency of international concern. So in fairness to the WHO, it has been very proactive in the way it has, been on top of this. It's been on top of this. And it has issued clear advice and directives as to this is what countries within are affected or adjoining affected countries should be doing. This is what countries who are not sharing, who are not within the theater of impact, but are sharing land borders should be doing. This is what countries who do not fall within these two categories should be doing. The WHO has been very clear about that. Okay. And so while obviously there is a lot to be worried about, one thing we can take comfort in is the fact that the early response to the outbreak has been quite proactive. And this is something that also reflects on what we as a national authority in Nigeria what we should be doing. It means we should also be proactive.
All right. And when you look at, since you mentioned Nigeria, we'll go back to the other questions, but since you mentioned Nigeria, when you look at our response to Ebola back then, Dr. Adadevo, may her soul rest in peace. When you look at the reaction of, do we say, the government of Nigeria at that time, look at all the things, the healthcare systems that were put in place. What we had then, from your view and your knowledge of Nigeria, do we still have them now? In their current state, are they able to prevent a virus like the BVD that has got WHO issuing a warning, an advisory to nations?
So that's an interesting question. So, Kayode, what I can say, because I can only speak from what I know. What I know for a fact is that since that period, and especially since the COVID pandemic, a lot of regulatory responses were advised and or measures were put in place based on international best practices. One was essentially under the amendment to the International Health regulation was the creation or the encouragement of states to create national disaster and emergency management mechanisms. Okay. Operational centers were encouraged to be introduced under the authority of the head of state and relevant government authority to coordinate response activities across partners and sectors to ensure efficient and effective implementation and monitoring of, outbreaks. We spoke about this in a couple of episodes ago when we were talking about the international health regulations. I remember we had Dr. Regine Habibi, one of my colleagues from the University of Ottawa, and we talked about the National Health Authority, the National Health Authority, or NHA. I don't know whether that's the full distance, but NHA was an acronym. NHA that was supposed to be one of the new entities created under the International Health Regulation as a standing committee to respond to emergency situations as a coordinating unit. So the point is, by law or by guidelines, certain structures have to have been put in place and should be maintained. And every country should have that. And that explains why we have the National Center for Disease Control, NCDC, which, by the way, did a phenomenal job during the COVID pandemic in terms of coordinating things. Now, a couple of episodes ago, we were speaking about budgetary allocation to health and the funding of the health sector.
Yes.
And concerns and alarms were being raised about how much was being, how much of health was being funded. So the other part of your question, which I don't know what I don't know, is whether or not budgetary allocations were actually being released for the purposes for which they were meant for. And if they were, how much was actually being allocated to maintain national emergency preparedness? Okay? This is one of those moments where you're going to write an exam, and if you didn't read the night before, then on the morning of the exam, you cannot be asking me what are the areas of concentration. Okay? Because you are definitely, even if I tell you the areas of concentration, it's not going to help you much. Okay? Because your preparation should have started earlier.
Long before, yeah.
I was just reading a news, like you said, be conscious of what you read on social media. But I was just reading something from social media, which, if it is true, should make us to be very worried. It says that the budgetary allocations of the current administration from 2023, 24, 25 have not been utilized for what they were being allocated for, that they have been pocketed. And it is a very highly reputable person who was saying that, Tambuwal, former Speaker of the House of Representatives, he was the person who was saying that. If he indeed said so, and there is any measure of truth to what he has said, then, Kayode, we are like the student who has turned up to the morning of the exam without studying the night before, and is asking for areas of concentration.
Hmm. Wow, that is interesting there. Very, very interesting. But when you look at this again, and if for such a virus that has attained such, should we say, global attention, has garnered such global attention as, and looking at what it is, as Nigeria today, do we have what it takes to handle it and prevent it from spreading? Putting in mind that one of the reasons it didn't spread in 2014 was because of a great individual, a nationalist, whose name should never leave the lips or mouth of any Nigerian, because she actually stepped in the gap and prevented a spread. She didn't have enough PPE, she didn't have a lot of things, but she just had to do the job. If you take out the daredevil factor in the prevention of Ebola in 2014, what could have been the fate of Nigeria? So let's look at that as well, moving into this new trend that we hope will not get to Nigeria, and prepare our minds for what you should be doing.
So, Kayode, so to that question, there are a number of things, I can say. But then I want to speak from, because obviously this is a question about, we're trying to engage in a bit of predictive logic here. We're trying to predict, are we ready? Because we're not working on hard facts.
Yes.
But I think when you engage in predictive logic, you can work on things that are established. Okay, patterns that are established can help you predict. Now, I would say that between 2020, 2014 to date, there has been a massive differentiation in the quality of our public discourse and in the caliber of our representation and in the expectations of citizens from their government and in the social compact between the citizens and their governments. At least in 2014, we were still kind of like a sane society. There was still, yes, corruption was an issue. Yes, there were all kinds of this, but there were at least certain baselines where you say the government would not mess up to this point. Do you get what I mean?
Yeah.
At least there was still a sense of public shame about failing to meet up with your responsibilities and all of that. I'm not sure that is still obtaining today. I think that there's a level of shamelessness in the current public discourse by people who are supposed to be representing citizens or acting on behalf of citizens. That makes me really very worried about whether or not one can believe anything they say. Because even if they say, oh no, we are ready, we are prepared. The question is, can we really say for sure that what they say is true?
What it is.
You understand? Because they can point to, and this is a government that has a lot of data. They can point, I was reading early yesterday, it shows that the economy is booming, that for the past 3 years of this current administration, the stock market has been doing exceptionally well. And somebody is going to, of course, supporters are going to take it and say, yes, this is why this is the best administration that's ever happened to Nigeria. But then the question is, who are those who are trading on the stock markets? The banks, the big CEOs, the big mogul, the business people. You understand? It is consistent with what we have always known about the current regime. That is a very sort of elitist sort of regime, in the sense that it's always concerned about the things of the elites, but doesn't have a touch for the common man, or doesn't have the best interest of the common man at heart. So if we are seeing a publication that says, oh, the stock market is doing well, but then I said, but Mama Sikira does not have money to feed her family. At least eat 2 square meals. We're not even talking about 3 square meals. I think it was on this show, a couple of episodes. I think the episode we were missing when your colleague who was on the show, no, not Oluwa, the guy.
Oh, okay.
Yeah. So we were talking about something, and I said at least Nigerians should be able to talk about, eat 3 square meals. He said, which one is 3 square meals? That they are struggling to eat 1 square meal. And we laughed about it because, It was like, which one am I talking about 3 square meals when people are still when people are dealing with at least have one meal first?
Surviving.
So if things have been reduced to the bare bones in that way, I don't know. I don't know that we have been doing, because what the question you've asked is really about, have we been doing our homework properly? Have we been doing things by the book? Have we been following procedure? Have we been guarding our, border? Have we been allocating resources to where it should be allocated? Have we been investing in the research and in the science and in the technology and in the equipment that will make Nigeria resilient to deal with public health threats? But that's really what that's the heart of your question. And for that, I really don't have an answer for that. But if I am going using predictive logic by how the current regime has behaved in other areas, I think that we need to have a Dr. Adadevo 2.0 on the ready, because we will need a hero or a heroine to stand in the gap.
And that's where I'm going, because a lot of times when we talk about issues in Nigeria, we just like the Arsenal victory,
Yes.
we just look at the good part, but we don't really dig deep to find out, okay, did they really play well to deserve it? Oh, they won, and that's it. Now, a lot of us look at Adadevo, Dr. Adadevo. I mean, we look at the Ebola crisis and we're excited. You hear people say, we managed it well. But I often ask a question. If not for the sacrifice of that brave heroine, would we be saying we managed it well? And that's why I asked that, okay, so have we prepared the minds of Nigerian doctors, a lot of who are looking for ways to japa? Have we prepared the mind of that health worker? Is it ready to see the symptoms and deal with it? If he sees the symptoms today, is he ready or she ready to be another Adadevo to prevent a spread in a situation where all the equipment you need to take care of such he's not a victim. Why am I thinking victim? Such a patient, the equipment you need to take care of such a patient is not available. Is a mental state ready to deal with that?
Well, look, Kayode, Nigeria has so many great, professionals in the health sector, okay, who are doing phenomenal work. My major concern is that the very good ones always have a way of living. The good ones, the ones that are doing exceptional work, they don't always stay long in the system because the system doesn't encourage them to stay long. When you find an excellent doctor, exceptional doctor, especially when the doctor is still at the beginning or middle part of their career, it's not like they are kind of like, when you become old, you're clear. It is clear that JAPA is not going to favor you because you're going to be starting over. So that doesn't make sense. Like then you're left with no option but to stay. But then the young ones who have energy and all of that are able to grow and are still on the growth trajectory. Many of them leave. Now, my major concern is that across the various sectors where proper responses should be developed and undertaken, that the capable hands who should be driving and steering things, many of those capable hands have gone, or many of those capable hands are not in place. Now, with the brain drain in our health sector, where a lot of our doctors, I don't know if I shared this on this radio, when my mom, before she passed, she had COVID.
Yeah.
When she was on, yes, I told the story of how in specialist hospital, which is a teaching hospital, a university teaching hospital, there were only 2 doctors who could operate the life support machine. And on the day she passed, none of them was available. Why? Because the other doctors who could operate the machine had JAPA'd. And this is a teaching hospital. So it was no longer a question of, okay, is there even a life support machine? Okay, there is one, but then the person to operate it.
Exactly.
So that's the concern I have, because you see, under the WHO recommendation, there are a number of measures that need to be activated in places that are affected. One, we need to activate our national disaster and emergency management mechanisms and establish an emergency operational center. You need people who are experts in public health disease outbreak management. And I know that the folks at the National Center for Disease Control have a lot of capable hands. But what I'm saying is that, are we sure we are doing everything we can to make sure that those capable hands are not leaving? Because if those folks are leaving, then we have a crisis with that. Then there needs to be risk communication and community engagement. Are we having the right people who can communicate the risk on ground? Like, let me tell you what, this show we are doing today counts as risk communication. So as we are, you and I now, we are contributing to Nigeria's efforts to respond to the BVD. Because a lot of our listeners who have listened to this show, maybe they didn't know that they've been looking at the news, reading the news, and be thinking, okay, it's happening to them in Congo. Far from us. But after today's show, they're now concerned. They're now be asking questions. Okay, they're now reading more about it and learning more about this thing. What we have done is a public health education program. We have just educated the public. We have communicated risk. We have engaged the public about this outbreak, raise awareness. Okay, because another thing that the WHO says is strengthen community awareness, engagement, and participation. So, in fact, you should be commended by the authorities for this episode, because what you have done is you're raising community awareness, you're doing engagement and participation according to WHO guideline. Then after that, there are other things like surveillance and laboratory. You need to have surveillance and laboratory capacity. That is where the problem begins to rear its head. Because do we have laboratory scientists? Are they still there? Or have they japared? Because those are hotly demanded occupations in many Western countries. Lab scientists, okay? The people who run around processing all of these samples and all that. Many of those people have found their escape routes to the West or to neighboring African countries where they are serious about their health system.
Or maybe they're not working in banks as tellers.
Or maybe they're working in banks as tellers. That's a good one too. Now, the other thing also we need to put in place infection prevention and control health facilities. All right. So this is where the hidden things begin to be revealed. You understand? Like when they say that when the breeze blows the buttocks of a fowl, you now see things that you're not supposed to see. This is where, if we haven't done what we are supposed to do, we'll now start seeing our shame in public. Okay? Because if we haven't invested in facilities that will be able to, I know we have those facilities, okay? But these things need funding, proper funding to maintain them, to keep them in this thing, also to prepare them to have the capacity. Then we also need to have patient referral pathways to access and access to safe and optimized intensive care. How many of our public health hospitals are properly equipped with the intensive care facilities to be able to deal with population outbreaks such as this? So you see now that this is where, if we haven't put in place the structures, it's a problem. Then we also need to have research and development of medical countermeasures. Our health research institutes or facilities or universities, are they properly equipped to be able to carry out emergency research to produce vaccines? Then border health, travel, and mass gathering events regulation. We need to be able to undertake effective border screening and screening at main international and internal routes. Okay. Of course, I know that our airports have capacity, because obviously you get to see when you're flying into the country that there are screening mechanisms that are put in place, cameras that can screen your body heat and all of that. But then all of this is working on the assumption that we understand the strain, the current strain, and how it operates. Okay, we don't know what we don't know. Unless we have, built our own capacity by, studying what is happening, try to put our attention to what is happening in the places where it is, where there are outbreaks, to understand what are the signs and symptoms you guys are observing, so that we too can begin to kind of like observe monitor population, especially at this point in time. What Nigeria can do is to monitor travel. Obviously, the WHO says you shouldn't shut down your borders. It's too premature. Because the other thing is when you start shutting down your borders, you're shutting away access to vaccines and therapeutics.
Okay.
Or people who can come and help you manage this. When you restrict travel, then everybody sort of stays in place. Then you too are stranded. You're left by yourself to handle whatever it is that is coming in. If you shut your border and then people come in with the virus, you're in trouble.
Okay, so a quick one here. As Nigerians, I remember during COVID, Nigerians were angry. How can government tell us what to do? They can't tell us to sit at home. A lot of that talk happened. We could revolt at times, but seeing that Ebola could be more deadly or as deadly, what are the symptoms that Nigerians should look out for? What are the things, indicators of someone who likely has Ebola? Are there similarities between the BVD and the previous Ebolas, the Zaire or so strain that happened, so that we can identify them and say, no, this one I should not get too close to him or her?
This is exactly the kind of information that Nigeria's public health authorities need to be passing out to the public. Okay? Because this is what the public awareness and education should achieve. It should give Nigerians the right information and tools to be able to know when they begin to see things happening within their communities, when they should start raising alarm. So there should be a coordinated, information dissemination about the BVD. At this point in time, awareness, we should start talking about, okay, what is the BVD? What is this all about? How does it show? This is something that has to come from the public health authorities because it's their responsibility as part of protecting population health. And to the other point about shutting borders, about the authority of government to do so, it is in fact a necessary exercise of, public health emergency control for the government to be able to take certain actions, such as restricting movements of people in instances where it is required to protect population health. There is nothing wrong with the government taking such a measure. What is important is that when the government decides to take such a measure, there has to be proper, adequate arrangement put in place. You can't tell people to stay in place and they can't eat. So you have to put in place proper measures to allow them to be able to obey that order.
All right.
And survive.
And a quick one here. If you can do this in 1 minute. The global north, the global south. Unfortunately, this is starting from the global south right now, not like COVID, which was from the other side. Has the global north have they been brotherly enough? Have they been supportive enough of all this?
No. They are beginning to repeat the same old patterns. We've seen them repeat. For example, Canada has placed a travel ban on some of the countries affected. They are beginning to kind of like, even citizens of those countries that are based in Canada, they say they cannot travel. And this is against WHO advice that non-affected countries should not begin to place travel restrictions. It's too premature. My concern is that somebody like Donald Trump and America, very soon they'll ban the whole of Africa because normally the man doesn't like Africans. He doesn't like Africa. So this will be another opportunity to scapegoat Africans. So the global north, they are not behaving the way they should be behaving under the commitments they've made under the international health regulation. But then it shouldn't be surprising. We've always said this, that our best protection is to strengthen our own capacity and capability through our own institutions. Africa has its own frameworks for responding to pandemics, which it created in 2019, the Africa Center for Disease Control. Africa Center for Disease Control has been doing very phenomenal work in the past. And so we can look up to the Africa Center for Disease Control to be able to formulate a continental response to the pandemic. Okay,
so let's look inward right here, back home in Africa. Thank you so much, Professor Gwaba, for this update. We hope we've, like we used to say back then in school, we hope we've been able to, with these few points of ours, we've been able to convince you and not confuse you that Ebola is real and the BVD virus needs to be attended to. Thank you so much, Prof. Enjoy the rest of your day. All right.
You too.
And that's how we wrap this program up right now. And I hope you've learned a bit more about the Ebola and the BVD strain that is out there right now. Keep yourself safe. Read a bit more about it. Follow the news. Don't just focus on politics. Politics will come and go, but it is he who is alive that will be able to sing praises to God when his candidate wins in 2027, whoever your candidate is. Maybe I should just find out from Anastasia who she wants to vote for in 2027, but that'll be me playing politics when I should be talking Ebola. Let's wrap up the segment. Up next is the news at noon. Don't change your dial.